A peripheral blood smear test is a technique healthcare providers use to examine your red and white blood cells and your platelets. Unlike some blood tests that are analyzed by a machine, healthcare providers do the analysis by looking at blood cells under the microscope. What are the reasons for performing peripheral blood smear tests? Here are some of the reasons why people are performing the peripheral blood smear test. You have symptoms that indicate potential blood disorders or other conditions. Healthcare providers know certain blood cells or platelets changes linked to specific conditions. Peripheral blood smear results aren't a diagnosis, but they add to the picture healthcare providers create to make a diagnosis. You are a candidate for a stem cell transplant, and your healthcare provider wants more information about your bone marrow and blood cells. You are receiving treatment for a medical condition. Healthcare providers may order peripheral blood smear tests to see if your treatment is effective. My name is Mwajuma Sheb Abdullah, a medical student from Lovely Professional University. I'm here today to present my video about peripheral blood smears examination. The apparatus we need a microscope, we need 2 glass slides, a dropper, EDTA blood, a Leishman stain, and immersion oil for focusing in 100x. First, blood cell components are generally consist of red blood cells, white blood cells, and platelets. These cells' morphology and counting are significant in diagnosis of hematological disorders. In order to examine these blood cells, a thin smear is prepared and the stained smear is observed under the microscope. Leishman stain is used for the staining of the blood cells. Leishman stain comprises a basic dye which is methylene blue and an acidic dye which is eosin Y, which will stain the acidic and basic part of the cells respectively. So now I'm going to explain about the procedures for the peripheral blood smear examinations. First, you're going to make the blood smear. But before making the blood smear, you need to ensure that the slide is clean and grease-free. Collect a fresh peripheral blood sample using a sterile lancet or syringe. Place a small drop of blood on one end of the slide. Using another slide or a spreader, hold it at 45 degrees angle and swiftly spread the blood drop across the slide to create a thin smear. Allow the smear to air dry completely. And then after that, we'll go for staining with Leishman stain. Place the dried smear on a staining rack and then flood the slide with Leishman stain and leave it for 2 minutes. This helps fix the cells on the slide. After 2 minutes, add an equal volume of buffer solution, or we can use distilled water to dilute the stain, and then we mix gently by blowing or swirling the slide. Let the slide stand for 10 minutes and you'll see a metallic sheen on the surface of the stain. And then we're going to, with the process of rinsing, gently rinse the slide with distilled water or buffer solution until the runoff is clear. Allow the slide to air dry in an upright position. After that, when the slide is completely dry, we'll go for microscopic examination. Once the slide is dry, place it under the microscope. Start with low magnification 10x to locate the smear's monolayer region where cells are evenly distributed without overlap. Switch to higher power, which is 40x, and then oil immersion. We use it 100x to examine cellular details. Evaluate red blood cells, RBCs, white blood cells, and platelets for morphology, size, shape, and any abnormalities. The interpretation of peripheral blood smear examinations. For RBCs, it will be stained pink to pale orange, showing shape and size abnormalities like anisocytosis, poikilocytosis, or inclusions. For WBCs, nuclei stain purple, and the cytoplasm varies by type, eosinophilic, basophilic, or neutrophilic, and platelets appear as small violet-colored granules. Peripheral blood smear examination is crucial for diagnosing conditions such as anemia, leukemia, infections, and platelet disorders. It provides valuable information that aids in clinical decision-making. To summarize, the peripheral blood smear is a fundamental technique in hematology, offering critical insights into blood cell morphology and disease diagnosis. We hope this video has provided a clear understanding of the procedure. Thank you for watching.